Hello, I'm Harry Hobson, President and CEO of Plymouth Harbor.
And I'm Karen Novak, the Administrator for Strategic Healthcare Initiatives here at Plymouth Harbor as well.
We have another guest with us today, someone who's becoming a regular on our updates.
Hi, I'm Curtis Cornell, the Director of Dining Services.
Good. We're going to go through our normal campus update today, but the other thing we're going to do is spend a little bit more time today on gathering sizes. We'll talk about the Wellness Center as well. And also I want to share some holiday cautions with everyone, and that'll include some excerpts I have here from the CDC related to holiday considerations and guidance for dining. I'll mention it toward the end also of the video that what we're covering here will be covered in a splash with the companion document from the CDC. So Karen, why don't you go ahead, if you would, on the campus update first.
Currently, we have 2 residents in the independent side that are positive for COVID. We also have 3 staff members that are positive for COVID. We have 2 that are over in the memory care ALF area, and then we have 1 in our main dining room. All of them are asymptomatic and doing quite well. We're looking forward to having everybody back on board on the team, as well as our residents back in Plymouth Harbor.
Okay, absolutely. Karen, I know how you've spent most of the day up to this time, and you've been with a representative from the Florida Department of Health. Share with us what that was about and what the result was, please.
You know, the Department of Health is doing active observations and coming to various long-term care facilities across the state. We had a visit from Sarasota County, who we really developed a wonderful relationship with over the last 10 months. What he did was he came and observed us and almost did an eye-popping experience for him, if you will, in that we toured the Smith Care Center, the ALF memory care area, and today we actually went into the main dining room as well as the main kitchen. He was quite impressed at what we were doing. He said we set the bar very high for other facilities that he was going to go to today. His observations included looking at our practices for infection control, how we were doing with COVID, looking at the staff and making sure that they were educated on the proper attire to wear when dealing with somebody that has a possibility of having COVID. They looked at the quality of the cleanliness of the area, as well as the staff's overall performance. And again, he was very, very pleased. So overall, Plymouth Harbor, we did a great job. We are a great team. So thank you, everybody, for all your diligence and your patience through this time, because it's been a long 10 months, but we're getting there.
You know, you always want to hear that from that third party, get that objective reading, especially from the Department of Health. That's wonderful. And that doesn't come by accident. That comes from a lot of planning and team execution to make this happen and really create that environment. So thanks to all of our team members for their efforts on this.
And even the behind the scenes people came into play when he actually started looking at our policies and really saying how well thought of they were and how easy they were to implement. So for all the staff that spent those endless hours putting those policies together, thank you.
I'd want to spend time now on gathering sizes. And Karen, I saw a couple of the graphs that you sent out earlier today. Not only from a national basis, we're aware where the numbers are going, but also from a county and local perspective, and they're just continuing to rise. That's been predicted, and we're just getting ready now to go into that holiday season, so which I think concerns all of us. And we are absolutely remaining committed to keep Plymouth Harbor as safe as possible. And I realize this doesn't come without some significant sacrifice. Regarding our plans for social gatherings for now, and hopefully throughout the holiday season, but we'll continue to watch those numbers, and hopefully we can get, as I said, through the season successfully. Let me start with the Wellness Center. The Wellness Center continues to be open, and the only change impacting residents is a further reduction in the class size related to in-person group exercise for land-based classes. Now, the number of land-based classes has been reduced from 16 residents, including instructor, down to 10, including the instructor. Now, all of our aqua class numbers already fall within these guidelines and will not change. So I asked Summer earlier today how that might impact us with that reduction, and she said it really won't, because the reality is that most of the time those group land-based exercise classes really fall within that new guideline of 10, including the instructor.
Now, Harry, I think that's really important to take into consideration is when we lower it to 10, a lot of it has to do too with the ventilation. We know that when people exercise and exert more energy, they tend to breathe heavier. And sometimes those breaths are a little bit more forceful on the exhale process. And when you have 16 people in that area, sometimes that can get a little bit concerning. So dropping it down to 10 for infection control, that definitely is a positive.
Good. Thank you for that clarification. And also, let me move to mask wearing. Mask wearing is the norm for the Wellness Center, but it does allow for certain situations where the masks are permitted to be removed. Let me say that again. There are certain situations where the masks are permitted to be removed to lower below the nose and the mouth. And let me share with you those times. All residents during water activities do not wear a mask when doing activities that may get your mask wet. Wet mask can, of course, make it extremely difficult to breathe. The secondary one is those residents who are already compromised with cardiac, respiratory, or other chronic conditions are not required to wear a mask while exercising. They must, however, honor social distancing. And I know that that's monitored very, very closely by Summer and her team.
You know, if you ever doubt respiratory compromise, I'll share a trick with you that you can understand and maybe empathize with those that maybe have chronic obstructive pulmonary disease. Is if you take a straw and you suck on it and you breathe in and out through that straw, put a mask over the end of the straw and see the difference it is when you have a mask over that straw versus no straw covering whatsoever. That's what it feels like if you have chronic pulmonary disease and you're trying to breathe with a mask in. It's very difficult.
You know, also I want everybody to know that our guidelines are backed, evidence-based, okay? And beyond that, on a local level, you know, we've certainly been engaged in conversations with Sarasota Memorial Hospital, their medical team, HealthFit, our own medical director. And for those that are not familiar with HealthFit, let me just define that for you. It's the region's only medically integrated fitness center that offers high level of safety programs focused on disease prevention, nutrition and weight loss, strength and balance, cardio, rehab, and wellness. So that it may be a little bit controversial to some folks. In that event, I would just ask them to approach me directly on that. Any resident that is uncomfortable with exercising near a resident, even other social distancing, not wearing a mask under these guidelines, please see Summer and she will get you an appointment that would really make you feel more comfortable. We'll try our best to do that. And I want to thank Summer, by the way, and her team for what they're doing to make the Wellness Center a very, very safe environment. You know, Karen, you know very well, you know, we've been this last round open, 22 plus weeks, and we've not had an issue with COVID through any exercise program that we have related to a resident.
Yes, Summer and her team do a wonderful job down there. They're there with the disinfectants. They're there measuring things out. Summer is really on top of things down there. And for that, we are so very thankful.
Absolutely. Curtis, want to talk a little bit about the gathering sizes as it relates to dining services. And now as we get ready for the holiday season, you know, I go through here and I talk in very specifics in the upcoming splash, but could you share with us, based on, we as an administrative team got together, discuss this. We've had our discussions with the Resident Association leadership. I know that they are supportive of this approach. So why don't you go ahead through that outline for us, if you would.
So we're so excited to being able to offer, you know, some of these social gatherings, and especially with the holiday season coming around. I know the residents are really anticipating being able to celebrate in some form or fashion, and we're excited to being able to offer this to them. As you had mentioned that, you know, we had gotten together as a leadership team, myself, Karen, Tina, you have also been down in these areas just to kind of walk the space, to kind of get an understanding of what it looks like. The Mayflower dining room and the cafe combined, we truly feel that it has plenty of ventilation that keeps us in a safe environment to where we can have these somewhat larger of gatherings for our residents. So we have focused in on the cafe, and we're going to be able to have at least a minimum or maximum, in an area of 30 residents in that specific area. And as it's outlined in the splash, and we've also sent out that communication to the colony directors as well. And we've already started kind of walking through and talking about some of these parties with those directors. The hours are from 2 to 5, just because we have to make sure that it's in an hour outside of our other normal dining service hours for the Mayflower. It's after the lunch hour and it's before the dinner, just so we make sure that we keep those areas safe. We don't have a lot of cross-flow traffic with residents that are coming for a regular dining event. We put together a prefix meal, which is basically a one price for the entire menu, that you have your selection of appetizers, a selection of entrees, and a selection of desserts. Currently, we have 7 of our colony directors have already started working with us and coordinating the event and moving forward with some of these, with this menu. We can also tailor it to fit your needs if it's not the menu that you're looking for. One of the colonies has already given us exactly a precise number of who's going to be having what. So it's great for us from a planning perspective, so we can ensure that we execute a seamless dining experience, all while keeping our residents and our team members safe.
Okay. And if anyone has a question about this, should they contact you directly?
Franco is the main lead contact. Of course, if there's other questions that aren't being answered, of course, you can always reach out to me. We're working as a team to facilitate these and tailor menus to fit the needs of our residents. The prefix menu that we put out there is just a guideline or a suggestion that we're making. And of course, you know, we're here and we're flexible to accommodate however we can.
Okay, excellent. I think everybody knows Franco, and he'll do his best to answer your question, or he'll find the answer for you. So very, very good. So you all done a great job down there, and let's go through the season as just as safe as we can. You know, as we near the conclusion of this video, you know, I just want to urge all of our residents to just exercise extreme caution during this vulnerable time. We sound like a broken record, but that's going to continue. That's by intent. We've done a good job overall with the cooperation from our residents and our team members to manage the pandemic here at Plymouth Harbor. But we got to remember that it is real. There's no question about that.
That virus is deadly, Harry. It could really take out some people, and that's something we really don't want to have happen here at Plymouth Harbor.
Right. And, you know, I was asked by members of the Resident Association leadership team to really comment on the fact that, you know, they know this too, that when we have had positive cases of COVID, whether it's a test or whether it's a diagnosis, it generally it often relates to situations where perhaps it was brought in from the outside, maybe from a team member, okay? If it's from a resident, our contact tracing shows us that that is coming from eating away from Plymouth Harbor and socializing at various receptions, et cetera. So it is a very vulnerable situation that you're being put in.
You know, when you venture out of Plymouth Harbor, you're exposed to, gosh, who knows what. We have so many people this time of year that travel down from the north. And as you know, the Northeast and Mid-Northwest areas are just astronomical with their numbers. So you just never know who might be sitting in that restaurant of 40, 50 people with you and what they may be bringing to you. But know that you then in turn bring it back to Plymouth Harbor and expose us all to that. So please be careful when you're out there. We do realize that, you know, people are going to go out of Plymouth Harbor, but put that mask on and keep that social distance. And most importantly, you know, when you attend these events or attend great large gatherings, 4 days after that, why don't you come by home care and we'll swab you. And that way we can tell if you were exposed to something out in the environment. And we can kind of take measures to kind of keep that virus contained. So for the interest of us all, again, 4 days after an event or a large gathering of people, please come see us in home care. We'll be glad to swab you.
Karen and Curtis, as I mentioned, going into this update, we've got to splash, and there'll be, again, that companion document, which will also have, and it is some excerpts from the CDC, the holiday considerations, as I said, and guidance during flu season and the pandemic. And, but, you know, there's some really good points they're making here. And I would urge everybody to read it. I would urge the families that are watching this video, along with our team members, to also do that. You know, it really falls in a range of prior to attending any holiday gathering, please discuss the risks, the benefits, and the alternative with your primary team and staff, your physician. Consider your potential risk if you should leave Plymouth Harbor. Know the risk of in-person celebrations, especially with large groups of people, including the possibility of bringing that virus back into Plymouth Harbor, increasing the risk of hospitalization and death to other residents or staff. It really goes on, and making a few other comments regarding folks that specifically live in our Smith Care Center. And please don't consider socializing with folks that are have any symptoms related to COVID. And Karen, let me put you on the spot. What are those symptoms? You see them and you send people home, or you put folks in isolation. What are those symptoms we need to be aware of?
You know, the most common symptoms that we're seeing and that we're hearing about are those respiratory symptoms, those chronic coughs, the wet, moist, congestion sounding coughs, the body aches, the headaches, the, oh my gosh, I just want to crawl in bed and go to sleep kind of mentality. Sometimes we're seeing people with GI disturbances. This virus is very, very fickle. So I often share, if it's something out of your norm that you're not quite feeling well, please come see us, go see your doctor, but don't just sit there and come to Plymouth Harbor to work or expose others to what may be possibly a virus that you really don't want to share. So definitely seek some attention.
Okay, very good. You know, before we conclude this video, I'd be remiss if I didn't share with everyone, and particularly family members that may not be aware of this, but we have an annual tradition here at Plymouth Harbor. We call it our turkey drop. And what that means is that every year, we've been doing it for, gosh, I've been here going on 17 years, so I can speak to 16 plus years we've been doing this. And that is that we give every one of our team members a nice turkey, and this year a nice size pumpkin pie to go with it, just as an expression of appreciation. And yes, we have some fun with that as well. And we always say, well, one of the newer members of our team, on the most part, will actually dress up like a turkey. I hadn't done that, so I made the decision on my own to go ahead, and I would be the turkey 2 years ago. And it's a humbling experience, and I did it. I challenged George McGonigal last year, and he did it. He was our turkey last year, and we had some fun with that. Well, it was obvious this year who would be the perfect turkey. Curtis, you did a wonderful job yesterday. And how many turkeys did we have out there, not including you?
Well, yeah, the biggest one was me. So we had about 220 turkeys that was in the truck, and we're still giving them out today and through the weekend, just to make sure that all of our team members have the opportunity to get the turkey and get that big pumpkin pie. So what a great incentive for our team members, and kind of a recognition for what they do on a day in and day out every single day, the work that they do. So for me to sacrifice one day to be a giant turkey, sign me up, Coach.
Well, I have to tell you, a few folks said behind your back, who is that big bird out there? Curtis, you're about 6'3" or 6'4". I have to.
I worked my whole life to get that.
I have to tell you that I have never seen such large angel wings on a turkey as I did yesterday. But you're a great sport. We all enjoyed it. And I can tell you how much our team members appreciate that gesture. And we feel so good being able to do that on behalf of Plymouth Harbor, our residents. It was wonderful. So thank you all.
Thank you, Curtis. It was a great sport.
Yes. Well, Karen, unless there's anything else, you want to help me bring conclusion to this video?
It'd be my pleasure. We want to remind everybody, please keep that social distance. Now, if ever there was a time to do it, this is it. Remember to wash your hands quite frequently during the day. Hit those high contact areas, your doorknobs, your keys, your cell phone with those antibacterial wipes. But most important, when a simple little mask can truly make a difference, we remind you, please, anytime you step outside your apartment, don your mask. Okay. Even turkeys wear their mask.
That's right. Well, thank you. And what I'd like to say is, once again, there will be a splash issued here on campus in a little while. And also, going forward, some folks would prefer to read rather than watch the video. That's fine. So we will, in the future, as we do a video, we will also put out some sort of written communication side by side with that. And we are, I think, through our first draft of some of the frequently asked questions, and that'll be shown here very soon. So, and many of those questions we're already answering through this video and the past splashes. So thank you all, and I think it's now time for us to don our masks.